Put now. You want me to?
జాయిన్ అయ్యారు ఆల్రెడీ. వీడియో ఆఫ్ చేసుకోవాలా? ఇక్కడ మ్యూటెడ్ ఉంటుంది.
Good morning, ma'am. You can hello. I'll just see with.
Good afternoon, ma'am. Can we start the session at 2:30?
Hi, good afternoon. Yeah.
Good afternoon.
Hello. Yes. Just give me a second. I'll just share my screen and then we can start.
Ma'am, we'll just start at 2:30. Okay.
Yeah. Okay.
అలాగే యుద్ధ భూమిలో యువని సాహసానికి గుర్తులు బొమ్మలు మాకు చాలా గర్వంగా ఉంది.
Yeah. Okay, I can move also. No? So, Okay.
Can we start?
We are good to go.
Avana, can we just wait for a few more minutes? Yes, please stay on mute.
Hello, ma'am. We are good to go.
Okay, ma'am, let's start. Good afternoon, everyone. Welcome to the session. My name is Prasanna, and I will be serving you as your moderator today. Moving along to our session, please welcome Dr. Shruti Mishra, who will be speaking to us on helping children cope with COVID or other family illness. Dr. Shruti Mishra has completed her MBBS, MD, and fellowship in developmental and behavioral pediatrics. Dr. Shruti Mishra is consultant in pediatrics and behavioral pediatrics in Ankura Hospital. She has 10 plus years experience in this field. She is passionate to deal with children and understanding their behavior. She is also a life skills trainer for adolescents. Please welcome.
Thank you very much for the introduction. Good afternoon, parents. I hope everyone is doing good today, and we have gathered here for today for a very important topic. So, because there have been a lot of talks about COVID and COVID. It's almost, I think, 1 year, 10 months it has been since we have been dealing with this issue. So, but today I would like to focus on something which is yet very underrated, and it's still not getting addressed specifically in India. There's a lot of talks going on in other countries as well. So I think we as a parent, we have the right to know about it and how to cope about it, because there are a lot of uncertainties that is ongoing. So today we will be talking about not only the physical health, but the psychosocial impact, the mental health that the COVID has on the kids. So basically, when we see at this iceberg, the physical symptoms, all the fever, cough, cold, in rare cases, hospitalizations of the kids also. So it is a very small percentage that we are dealing with. But the mental health, the psychosocial impact that is there, it has the children are losing their very precious time during, which is very important for their overall development. So because they are facing a lot of social isolations, they are not going to school. So how does it impact, and how we are there to empower you today. So we will be dealing with that. So what is the impact actually of COVID-19 on a child's mental health? So first we'll be talking about it. Why are we talking about all these developmental issues and all that is coming? So first thing is there is a lot of uncertainty. Kids don't like it when they are kept in dark. So we as an adult, we are talking about the risk of the viruses. All the cases are increasing. There is so many deaths that is happening. But children, they don't know. We are at some point of time, we are not very comfortable on sharing information with kids. So this fear and the lack of information it has a very bad impact on kids. Then again, frustration, boredom, because every time a wave comes, we are inside losing our precious times of involvement with the family, contacts and all. Definitely the academic impact, even though the school, the teachers, they are trying their best, you as a parent are trying their best to cope up with. still there is a lot of things that needs to be taken care of. And apart from that, other family difficulty, loss of close ones, many things are there that can impact their psychosocial health. So how to deal with it? So we know the problem, we have been talking about it, and you as a parent actually have been dealing with these situations in the last 2 years, so you already have the first hand information. But I would like to still focus on few important aspects that is there. So whenever there is a crisis at home, specifically now when we talk about the current aspect, so many kids who are in the school age group, like 6 to 11 years, the teens, they already know a lot about COVID. The ones who are still very young to understand, they actually are now in the phase like where we can make them understand things. So there are waves. This is the third one that we are facing now. We are very uncertain what will happen in the future times. So in this situation, there are 2 to 3 things that we need to tackle with. One is like whenever there is a sick, when a person is sick in the family or the child is sick himself. So in that situation, or if someone is hospitalized in that situation, the child has to go about vaccination, the child has to undergo a lot of tests also, sometimes some screening tests and all that is there. So even small things like this, or even if there is no one sick in the family and constant news about all these situations that is ongoing, so this creates a lot of impact. And in the any kind of stress situation, there are 3 things that children like generally want to know about. Am I safe is the first question that goes into their mind. Are the people caring for me safe? How, like mama will safe, will papa will be safe? And how will it impact if I'm not going to school again? I was very happy going to school, now suddenly why is it like that I don't have to go to school? Now suddenly why am I to sit at home only? So how to explain kids this? So whenever we are trying to talk about any situation for the kids, so it has to be always developmentally appropriate. See, every kid, every specific age group, they have a very different kind of approach that we need to deal with. This is because of their development. So kids, I have also included a few points about the preschoolers, because many of you would be having children who are less than the school age and all, or having any relatives that you can help out with. So children between 2 to 6 years of age, they have a what we call it as very pre-operational stage of development of thought is there. What does that mean? They mean that they take face value of everything. So if they see picture, so they will be taking it as that. If they hear some news about some bad situation, so they'll be taking it as that. Okay, so they learn by seeing others, they do a lot of imitation, they see parents what they are doing, and they learn by the surrounding behaviors. So this is very important for us to teach them in that way also. So if again someone is sick at house, or they need to follow all the personal hygiene, all the social distancing, then how can we explain it to them? So the first thing is, first, as I told you, because they reciprocate the feeling of the adults. So in that situation, first thing for us is we have to stay calm. If we are anxious, children also get anxious. So turning off the TV, no unnecessary details, because again, they will not be understanding that the same news is getting repeated through and through. They might get scared at every time the news is getting flashed. Okay, and we have to be very careful when we are talking about the same situation to others. So suppose we are on phone and we are speaking to someone, oh, so and so is very strict, I'm so afraid. So then they also pick up. Kids are listening. So even though they may be playing, they may be engaged in something else, they always are listening, and we have to be very careful. And therefore, children at this age, they need more comfort. So even if the kid is sick, so even the kid is having COVID-19 or something, then there are various situations that can happen. So only the kid is sick in the house, and no one else is showing the symptoms. So in that case, what to do? So if you have any vulnerable person in your home, like someone with a lower immunity, grandparents, even though they are not showing symptoms, we can ask them to self-isolate themselves. But the primary caretaker, the parents, at least the mom or the dad, has to be there at home. So how can we help with them? So we have to follow all the personal protective hygienes, like we have to wear gloves and masks, but be nearby them as much as possible. So for very small kids like infants and all, we cannot avoid the hugging or breastfeeding them. So that also has to be taken in precaution. Okay, so for some other kids, so we can can sleep in the same room for them. We can maintain safe distance, yet be involved with them, playing games, talking, singing, so that there is a positive environment that is there in the house. And definitely using a lot of pictures. So if you want to have some reminder at home, so you hang pictures all over there. You hang at the entry of your house, you hang it at the entry, at the nearby the bathroom, nearby the washroom that is there. And also use languages which are very specific, very short, and for easier for them to understand. Reassure them every time. So they may have fears like, what will happen now, Mama? If someone is getting sick, what will happen? Will I also get sick? So just reassure them that adults are there to help them, because giving too much of information in a preschoolers, it will not help much. But yes, you have to be honest with whatever you are saying. And make games. So they say that if we are washing hands, singing happy birthday, so if you are singing it twice, it amounts to 20 seconds. So same way, songs such as Twinkle, Twinkle, Little Star. So make it a fun game for these kids. There are a lot of PDF files, that there are a lot of pictures that are available, use of social stories, comic strips, which can be helpful for kids at this age. So these are freely downloadable from the net. So these are the few examples which can be used for teaching them, reminding them through and through. Because behavior is such a thing, if we are giving command once and they will not do it for always, it is for us also it gets difficult. We have to be reminded every day to wear helmet in a two-wheeler, to wear the seat belt. So for them also it is difficult to follow any kind of behavior. So reminder, constant reminder, helping throughout is very important. Talking about kids of school age 7 to 11, so they are more better, they more understand more of concept, they are able to take the feelings of others, they are able to understand the feelings of others also. So for them we can use, when talking about giving them the information, talking about the virus, why it is important to wash your hands, why is it important that grandma and grandpa are in isolation now, why is it important for us not to maintain social contacts. So if you are giving them some kinds of small fact-based information, that will be fine. And we have to remove any kind of misinformation. Many of time they will be talking with their friends and they'll get a lot of misinformation. So that needs to be cut down. And we have to, they have a lot of fantasies that goes on their head. So it is very important for us to separate it from that. So this can happen if someone is getting very sick. This can happen if I get the virus. So we will have to tell them that we are there for you. We are doing our best. Everyone is doing their best to save you, to prevent all these viruses, and nothing will happen to you. So that reassurance needs to be given. And kids at this age, they do very well when they are in routine. Actually, if the kids they feel empowered, then when they know there is a predictability. So in the sense, like in the morning, you get up, you are doing this. When you come at the house, you have to wash your hand, keep your clothes over here, keep your clean clothes over there, dirty ones over here, how frequently to wash and all. So all these things, it is very predictable for them. They think that they have the situation under control, and always complimenting them for good behavior. So if they say, Mama, see, I have washed my hands too, they do remember always to compliment them, because even though a very small effort, it is very important steps that they are learning with us. Definitely kids 12 years and above, they have more, they already know a lot about, they read about a lot of things. So at this age group also, it is very important to speak to them, and we can sit down with them and actually serve sites which are very relevant and which are actually trusted websites. We can give them the list if they want to read it. And we can engage in family decision making. So then also they feel very empowered. Okay, so and then all the anxiety and all decreases. So for example, so now you can ask them, so this is again the third wave coming, and it has already come. So how can we cut down? So you tell me a few important points, like how can you cut down? So they themselves may tell, okay, Mama, so I'll stop going for swimming classes for a few days. I'll stop going there for a few days. And when it comes from the child, then they definitely want to follow it, instead of us enforcing them all the time. Or you may ask, so suppose, yeah, come on, from today we'll have to be under quarantine for this situation. So which rooms to be used, which room will be better? So what else we can do? So taking them into consideration, we can actually involve them in daily course, helping their younger sibling, reading out stories to them, helping us in doing our kitchen works and all. Next, coming to modeling behavior, this is the most important thing. So we practice what we preach. So just preaching kids will not help. We'll have to practice them. Be a role model for them. Unless we are washing our hands, unless we are wearing a mask properly, unless we are avoiding very close contacts, so it is impossible for a child to follow that. So be it of any age. So children of a lower age group, they will not follow us much then if we are not doing it. And other age group like the higher ones, the adolescents and all, they may instead question us that if you are not doing it, why should I? And definitely, like it, as I was telling, it gives a sense of control to them. So when you are coping, for example, if you are kind of stretching out yourself too much without any relaxation, without taking any breaks, so then it becomes, it is a kind of, they are also learning the same way. So do remember to take small breaks, make healthy habits. You yourself eat a good diet, fruits and vegetables, do exercises regularly, then only they'll copy this. Teaching them social distancing, by playway method. So if you are there, 2 to 3 siblings are there, some cousins have come over, so you can teach them. So suppose, oh, come on, we'll fly now. So now, okay, that's a good thing. We are at a so distance of around 1 feet from another. So in this way, for small kids, for younger ones, we can model the behavior for them. Addressing the anxiety and worry. So children, they do get anxious. Many a times it may not be evident, so you will have to take non-verbal cues also. So what are those non-verbal cues? We'll be talking about in a few slides later. And you have to always acknowledge their concern. If they are concerned about anyone getting sick in the family, or themselves getting sick in the family, any other stress that is there, so you will have to acknowledge them, listen to them what they are saying. So while listening, we'll have to always, if we are questioning them, you can put open-ended concerns. Okay, so what do you know about this? What have you heard? Do you have any questions that I can help you to answer? Do you want me to do anything that I can help you? And never ever with your questions try to feed their fears. So by this what I mean? So just don't tell them, oh, this person is sick. Are you worried about that? Are you worried that they may get sicker? So it is a kind of, even though the child might not be thinking this, are you worried about the vaccination tomorrow? So even if the child is not worried, so it may feed into their means mind that, yeah, this is a scenario now, I should be worried. So never, it should be a healthy discussion with facts, age appropriate, but never feed their fantasies a lot. Okay. Next comes, definitely, some kids, they may not be able to express everything. So those who are a bit means not so verbal about it, so you can use this kinds of picture charts. So again, like you can just ask them to draw their feeling, draw their emotions actually, and you can ask them to mark, oh, how are you feeling now? So today I am like this, I am happy, I am relaxed. So how are you feeling today? So in that situations, if you think that the child is not able to express it, so these kinds of charts actually may help to when they're feeling out. And always it is, if you don't know something, when will the school reopen? When will someone come back? So don't avoid it. It is always safe to say, yeah, I don't know that this point, but gradually it will come to know. Then they will also start trusting you. And always set the tone. Like when you are calm, the child sitting in front of you will also be calm. And tell them that it's okay to feel upset. Let them know this is a very normal behavior. So the whole idea is not to decrease their anxiety. So because anxiety, this is a very important factor. So this is the time actually we can teach them some coping skills. This is a time that we should not avoid any situation that creates anxiety. Instead, teach them skills. So if they are concerned about vaccinations tomorrow, oh my, I'll get hurt. So you just don't tell, no pain will be there, you can go ahead. Tell them, yes, there might be a small pain, a bit of pain, but it's okay. I'm there with you, and it will go away after some time. So teaching them a lot of coping skills, it will help them in a long way also. As I told you, keeping usual routines and creating more routines. If you are not already doing a lot of activities together, meal time, eating dinner together, playing some kinds of fun game, start doing it. and creating a positive environment at home. So you as a parent are the only person who will be able to create it. So celebrating more time as a family, making it fun as possible, doing projects together, creating masterpieces and all. So all these things, it will be a lot helpful for you. And you yourself, like what we can do is we can so suppose now again there is like the schools and everything is closed, so children are not able to connect it to them. Many of them might have fallen sick, so take out time, so take connect there with their family, take out some make connect with them online, so in which 4 or 5 kids along with their parents are there together. You can have a online coffee break kind of thing. So and just any like all you can encourage the adolescents even to connect via online. You can have a group activity together, so it will help. So there are a lot of coping skills which the adolescent can also do it by themselves. Sharing is an important thing. Okay, and always talk to your child and know them that you're prepared to keep them safe even if some certain situation happens which is bad for them. Okay, and as I was talking about some warning signs, so there are a lot of warning signs that can be there. So in which the children are in a situation, any kind of stress can precipitate these kinds of warning signs. So any symptoms which are present more than 2 weeks, so each age group again will present with different symptoms. So preschoolers, they may have a lot of thumb sucking issue. They may regress in their development. So what does it mean? So there can be a lot of sleep disturbance. There can be loss of appetite. They can fear the dark. There can be a lot of withdrawal that can be there. There will be more clingy. Kids of elementary school age, 6 to 11 years old, they may start having a lot of nightmares. They may avoid social situation. They may have poor concentration. They may have some kind of somatic complaints, physical complaints, what we call it as. So continuous stomach ache, headache, not attending schools. There can be irritability that may be there. Adolescents being more vocal, they kind of vent it out sometimes in a very wrong way. So sleeping and eating disturbance can be there. There can be a lot of aggression. There can be physical complaints, again poor concentration. There can be some delinquent behavior. So any child who is having these symptoms for more than 2 weeks, in that case definitely you should take a health professional's help. Children with special needs, definitely it will be like more difficult for us, and actually it will need extra word of reassurance for them, more explanations about the event, and a lot of positive reinforcement from our side, such as physical contacts, having hugs from the loved ones to calm them down. Suppose there has been a severe loss for a child in a family, like kind of death of some near and dear ones, which unfortunately we are seeing a lot. It may be someone such as close friend, grandparents, any means parents. Then in that case, it becomes very important for the child for us to counsel the child in that situations. So first thing first is we ourselves have to be calm. We have to tell them that we are available for them. And in case of adolescents especially, it can happen that they may have a lot of guilt because of unknown reason, so they may have that because I did this, it might have been there. Even in kids of school age, please, they might think that, oh, I was a bad boy, that's why this has happened to me. So make sure that they understand that this is not their fault. And then we should not give a lot of stress in this situation to them, like if trying to move away means to a new place or something, pressuring to perform well in the school, or you are not studying, or we ourselves are having a lot of interpersonal issues and all, frequent moving or change of places of residence, because these will be additional stresses to them. Tell them that it is okay to be sad, and just remember that it takes time for them to heal off. So just ask them to like just be short, ask them to write out things if they are not doing it by themselves. And what we have to do is, if they are too much clingy, if they are acting out, being aggressive, we should keep ourselves calm. We should not shout at them, we should not get upset and angry, because we have to remember that they are not doing it on purpose. Okay, and we have to always keep a watch on warning signs, which I have discussed in the previous 2 slides. This is a very important thing. last thing that I would want to tell you is, like, this things, life will go on even after that. Once the wave comes down, then again we will kind of actually go to our routine works gradually. So at that time also, even though we are vaccinated, even though kids of 15 years and above are vaccinated, we have to make sure that we are following these guidelines very regularly, like wearing a mask indoor in public places, where like auditorium, it's a mall, in place and try always remember to place an extra mask in your child's backpack, because it is very easy for them to spoil it off. If the child is like mature enough to use a sanitizer by themselves, they should always do it. Try to, in this situation, so make a use of this situation in a positive way, that I would always like to say, and show children that every bad aspect has a good aspect. So if you have a trip that has been cancelled because of this, so reschedule it at a later date. Give them hope. So like, yes, after this goes away, we will again go. So that the whole family, instead of just means screaming because of it, you will be having something to move to look forward to. And definitely, we as a parent, we are the pillars. So this is this is not just means a statement that we made. It is a research-based thing, that if parents are stressed, the whole family relation can get stressed. So it is not only the individual who is facing issues, but the individuals and the child's relationship also gets affected by parental stress, because we are not in a healthy state of mind to handle the kids, to handle their behavior. We may be rude, we may be sometimes, we may have a lot of issues in that situation. So always first take care of yourself. So even like when we travel through flights and all, first thing they say is take care of yourself, put oxygen mask on yourself. So that oxygen is very important for us. So remember, like, we cannot do everything. It is not possible for a mother to a father to do everything throughout and make it. Don't try to be a perfectionist. Try to take out time for yourself, definitely. So these things, set priorities. This is important for me this week. This can stay here. So don't compromise your time. Don't compromise your relaxation time, actually, for anything else. Spend time with your family. And even sometimes we as a parent, we get stressed. So always talk to the folk that care for you. So I as a, like, I still, like, whenever I get stressed, I do call my mom and ask her, mom, this thing has happened. And whenever, like, after the call, definitely I am 1,000 times more relaxed than I was previously. Just a word from her side that, okay, everything will be okay, don't worry. So this is fine for me. Then I can get back to my work. So this connection is very important. And this connection, the constant reminder of this connection needs to be made for for yourself as well, and as well for the kids also. And take out time to go out of the house sometimes, like, at least now, if it is not possible to go out somewhere, at least in your campus only you can do it. And not just for getting out groceries and all, but taking time, or even in the balcony you can watch the morning sunrise, evening sunset, just having a sip of coffee. The thought of these things only is quite relaxing. So actually, if we are practicing it daily ourselves, taking out 10 minutes from our busy schedule, definitely it will go a long way. And definitely always plan for your future, for the next 3 months, 6 months, 9 months. So if this thing is supposed going to happen, what should I do next? So this way it will be easier for you also to cope up. And always control your anxiety, because right from the start of the talk, I'm saying that this is what reflects on your kids also. If you are anxious, if you are angry, the kids also get anxious. So definitely, and these are few resources for the kids to read up, specifically for adolescents. So if we are talking to them sometime, if as a parent, they may not accept everything, but when it comes from a resource, from a net, they will be accepting it better. So for these sites for the young minds, there are sites in which there will be activities like meditation, like yoga, or some like relaxation techniques, which can the kids can follow by themselves. For small kids, there are a lot of videos on YouTube, which actually you can use to teach them all the hand hygiene and coping up techniques and all. And the and the most important thing is how to engage the kids. So we have spoken about all the things, engaging, what to do, how, I don't know. So there are a lot of sites in which you will get These are the free activity sheets for them. So like kind of mazes, and also just take out one new thing every day. Just get a printout and just do it with your kids. If maybe joining the dots or something. So age appropriate activities are there. So these resources, just let us know if you are interested. We'll share it with your school personnel, and it will reach to you. So with this, I end my talk. So, and at last, I will say that this is my favorite quote actually, that this too shall pass. So I think we all are working together. A lot of thing has already happened to us, and everything, every time we emerge stronger. So this too shall pass. Thank you very much for patient listening, and I'm open to questions and discussion now. And I will request parents to share their personal experience as well, because here we are not to hear some lecture today, but to discuss. So if any situation had happened, and how did you cope up with it? So each one of us are learning something today with the first-hand experience. Thank you very much.
Yeah, thank you, ma'am, for enlightening us on this topic, which I'm sure that every parent can relate to in their day-to-day life in this current situation. So yes, let's start our Q&A session. So if any parents wants to ask or discuss the situations, I would request you to please unmute and ask one by one. Dear parents, if you have any questions, please unmute and ask one by one.
Yeah, even anything to share. How are you coping up? Any activity that you have taken? Anything.
Dear parents,
So,
you are
do
free
we
to
have any teachers
discuss.
also here today?
Yeah,
Like
we
who
have
have
few
joined with
teachers
us?
as well.
Anyone from the school staffs and all?
Yes, we have.
Yeah. So, if like maybe we can ask them to share their views, their viewpoints, and also it will also help for the parents. Any coping skill that they will also suggest from their side.
Yes, dear teachers, please pour in your thoughts.
Good afternoon, doctor.
Good afternoon. Yes.
Recently, we have been tested positive. It's been a week, but my kid is doing fine, ma'am, as of now. I just want to ask, like, if there will be any chance for her to be testing positive, because till today she's still negative, but we both got affected, me and my husband.
Okay.
So I just wanted to ask you this question. I'm not sure whether this is the right question or not, but I just have the doubt in my mind.
Okay. What is the
And
age of your kid?
she is 7 years old now.
Okay, okay. And like 1 week back, you both yourself and your husband started to have the symptom,
Yes,
right?
this is
Oh,
our eighth day.
okay, okay. Now, if till now she is not having it may be less likely, but we'll have to keep a watch for another 1 week. So the present guideline says that actually if the child is not having symptom, we needn't test them, but keep a watch on the symptom. Anytime during this period that she is having developing any fever, better to get her tested. So
Okay.
like if, there may be chances, because sometimes the incubation period, what we call it as, it may take it may be higher in kids and all, so definitely, but just take care, keep a proper watch, keep her hydrated and all. That will be all as of now. If she's not developing any symptom for the next 1 week also, very less likely in that case.
Okay. And one more thing, ma'am, like we both have too much of weakness and we are not able to spend time at all with her. And the food also we are taking like some the easy, whichever will be easy. I'm preparing that and I'm giving. But she's getting upset a lot seeing us like this, and she's crying a lot. We are trying to deviate her, but like when we go to sleep, she's sitting and she started crying. Like this is happening with her.
So
Other than only she sees iPad, I'll give her iPad if we are not able to play with her. Like if we are okay, we are playing, but we are not able to give her much time. She's just watching iPad and suddenly she started crying, and she's getting up in the middle of the night and crying. It's like that. So any suggestions, ma'am, any advice for that?
like any other person in your house, that is any other support that is there as of now here?
No, ma'am, no.
But I just want to, she's 7 years. Generally, like 7 years old will not cry just because of parents' attention. Just talk to her. Talk to her. What is the reason that she's crying? Maybe there is
She's
something.
telling that only, ma'am.
Yeah.
You both are sick. I'm not able to see you like this. When you will be out of this, she'll go to God and she keeps praying. She'll start crying in front of the God. It's like I have never noticed such behavior, but only since a week she's doing like that.
She's
Like
concerned actually about you. That is why. That is the reason
but
that
I don't want that to happen, ma'am, because he is also getting upset a lot and she's not eating properly. So any advice for that? We are asking her to read stories and all. She's doing all those, but suddenly she'll start crying and she'll ask, "How are you now? Is it okay?" Even if we get up and do work, also she's like, "How are you now? Are you feeling fine?" It's like that. She's starting crying. Suddenly she started crying.
So, try to connect her to, means make sure that daily in the morning or evening she's connecting to some person, at least virtually. And virtually in the sense, some play group kind of thing, like maybe 4 or 5 friends of hers. They may talk to her in the evening. You can arrange a play kind of something, because already it has been 7 days now. Now I think that transmission of the virus thing, that like actually you are out of quarantine period as per the current guidelines.
Yes,
So it is safe for you, but still you wear a mask, proper hygiene and all, and involve her in some kind of play. I know it is difficult for you because there's a lot of weakness, but make sure like at least she starts with something, you know. So in the evening you can talk to some parents of her friends in the school, or maybe your parents, some cousins and all. In the evening you can have kind of a play date kind of thing together. So see, at this situation, involvement is the most important thing that is there. And every day remind her that you are getting better and better. Tell her that it is a matter of only 1 week that is there, and after that we'll be completely fine. So we are gaining strength, we are having food and all. Just reassure her. So two things
Yeah,
as of
she's
now.
seeing, mom, actually. She's seeing
Hmm.
us walking around and doing our work, but still she is concerned a lot. She's crying. That is what I'm worried. Why is she crying like that suddenly? This never happened before. Only from the past 1 week, she's doing like this. Like we'll have high fever, so we'll be covering up ourselves and sleeping. And she's like, why are you doing like this? Why are you
Anyone
shivering?
is talking about any issues like kind of this thing, or she's seeing something, some kind of videos or something which is scary for her, like this will happen when you have COVID, or this will happen when you have COVID. Some news
Maybe,
channels
ma'am,
that
from
is.
1 week I am not noticing her. I'm not observing her properly. Maybe I'm not sure also because she keeps searching a lot. Maybe that might be also the reason, but I'm not sure. I just wanted to ask if like there is any advice which you can give us?
See, at this moment, I think a lot of support for her. So now, since I means take time to spend with her, now actually you are out of the quarantine period, involve her in few games, and it has to be supervised. So even if she's searching something, you can just sit beside her and all, and not a lot of physical activity, but some mental talks and all. You can tell her stories of family. So suppose when I was small, so something that has happened, kind of a family emergency kind of thing, then you reacted, each one of you together, and then we came out of it. Something which she has a good memory to share with, or maybe last year we went there, kind of one talk, one story every day. So it has to be a play date in the evening with the friends, something in the morning, half an hour that she's engaged with some other people, and at night a story time for yourself and the child. So at least we will try to do that, and then see how it is happening. So mostly she will cope up with it. Okay, so but if she doesn't, in like even after 10 days and all, even if you get better, the worry is there, then in that case I think then better like you can take a professional help in that situation. See,
Sure.
anxiety is a very common thing. And as I was telling, this is the time we can teach them to cope up. And she has never seen you in this situation before. So it might be too much for her to handle. And she being alone, no one there for her. So the whole mind is actually thinking about this thing throughout the day. So she must be surfing also the same things in the internet. We don't know. So
Yeah, maybe. Yeah,
yeah,
that might
just
also be the
take
reason.
care of that. Nothing
Sure, sure.
to be very worried for you as well, but gradually we will try to engage her in some or other way. If it is not possible for you, someone else. Okay, just see,
Okay.
and like if anything, we are there to help you out. You can always reach out to us.
Sure, sure. Thank you, madam. Thanks a lot.
Thank you.
Actually, I have two kids. So with the elder kid, when my dad passed away in the April 2021, since then, whenever if he sees some animal is suffering or anybody passed away like that, he starts crying immediately. And even sometimes midnight also during sleeping hours also, he'll be just sleeping. He'll be crying very silently. Says you two will become old, and like that he'll start saying, and he keeps crying.
What is his age presently?
10.5 years, ma'am.
And when did this happen? This incident happened when?
This we are once in a couple of weeks like that.
Okay.
And sometimes he wants to mingle with everybody, like he calls his friends to play at home, but when they came to play with him, he sits alone and he starts playing, but he wants to mingle with everybody, and sometimes he will be playing alone even when all are there around him. So this behavior we are not able to understand what to do, and your suggestions maybe of help for us.
Yeah. So see, because it has happened a few weeks back only, so any kind of any kind of event, reading the news about COVID, so this can trigger the same situation. So for him, like these kinds of, he might get upset again. This is very common. So first thing, we will have to try to avoid any kind of triggers for him. So don't watch too much of news channels, because here we have like they will do it in such a way that even we also as a we as also as an adult get scared sometimes. So this much cases and all the way that they show. So try to avoid the situation. So even newspapers and all lying down in the house if you are having that. So first thing is avoiding those things for him. Second thing is 10.5 years. So gradually try to talk to him. Have you ever tried to speak with him about this situation? And what was his response? Like, is he still scared that it might happen to means you also when you get
Yeah,
kind of thing? Or
he says that one, if you
how is it
become old,
happening?
you two will pass away. So I want always you both to be with me, and he starts crying. So that's what he says.
Okay. So reassure him every time. Yeah. So you'll have to reassure him. So first thing is keep him engaged into some of the other things. So empty mind is a devil's workshop. So make sure he has a schedule, because now because again the schools and all are closed. So apart from the online classes, it may be difficult for us to keep them engaged and all. So try to keep him engaged, make him into a schedule. This is a very normal reaction to stress, but if it has been a lot of weeks, then we will have to start counseling him a lot. So talk to him every day, and don't talk about the situation, but at night make sure that you are talking to him. What has happened throughout the day? What did you do? Because as you were saying, if he is showing withdrawal behavior, which earlier was not there, so we will have to take special care for him. Don't worry, he will be fine. This is a very normal response to stress, but we don't want to overstretch it. So keeping him busy in some other activities. Try to means once the situation gets better, try to means indulge in some kind of activity, maybe going to a relative's house or somewhere, so his mind is distracted. Because the more he is alone, the more he thinks about it, this thing, it will be difficult. And always, whenever he actually gets himself into talking about all these things, reassure that we are there for you. We are there for you, and we are always there. So it will not happen that we will let you be alone. So we are not going anywhere. So don't think about it. Tell him, like, be strong. Whenever you get these kinds of feeling, you tell them. So be strong. Okay, so you'll have to
Sure.
kind of try to cope up with it. So let's see, you do it, he will definitely need more support. So this is not he's doing purposely, but if it is going for a long time, then better, like, we will have to intervene him on a very this level. Okay.
With the younger kid, suddenly he's these days he's becoming so aggressive, ma'am.
Mm-hmm.
He stuff I won't do, I don't want, like words he used, and very adamant. He has become very adamant in past 5 months.
Okay.
So we're trying to counsel him. Okay, you should not behave like this. You have to do like this. You have to follow. See, your brother is following. Why you are not following?
Mm-hmm.
But still, he's becoming more aggressive and more arrogant.
Okay, and it is specifically to any particular situation, or a very general basis he does it? Like only with respect to studies, eating or something, or it is a very general
Almost
thing?
for anything, ma'am. Generally, even if we say study, I don't want to study. He said just the reply comes, I don't want to study.
Mm-hmm. Okay.
If we say just do this thing, I don't want to do.
Mm-hmm.
But the first thing is he opposes. Then
Okay.
if you have to do, you have to follow, you have to, so with some resistance, then he starts doing.
Okay. But he will be gradually, like, if you say him firmly, kind of thing, he will be doing it by himself. That is a
Yeah,
situation
ma'am.
as of now. Okay. And what is his age? You said
7 years, ma'am. 7.5.
7 years. Okay. So just one. So have you tried any kind of reinforcement for him? Once you complete this job, so today you will be getting, like, using a star chart kind of thing for behavioral management. Anything that you have started to use?
Actually, for mobile, for example, we got that COVID that time.
Sorry, you are, yeah.
So that time we given to computers to both of kids to manage. They should not come from that room like that.
Mm-hmm. No, sorry, I didn't get you. Can you just repeat it? What had happened during the COVID time?
Actually, ma'am, my wife was affected with COVID, and she was isolated for 1 week. After that, she was admitted in hospital for another 5 days.
Okay.
And my mother was also in hospital because of some surgery she had with femur, broken femur. Both the kids, we have the laptop so that they were engaged with their laptop and they were playing on the laptop and they got addicted. After anything, okay, if you complete this task, then I'll give you half an hour mobile or like that. So now slowly control this addiction. Sometimes he says, if you give mobile, then only I'll do.
Okay.
Completing even 20-30 pages within half an hour, ma'am. For mobile, he wants to do anything.
Okay.
He wants to do any work very fast, very quickly. Okay, if I will eat, can you give me computer? Can you give me a mobile for 10 minutes? Like that, he's asking, ma'am.
Okay. See, the thing is, we should, whenever we are doing any kind of if we are giving any kind of reinforcement to the child, we should never give something which is very tangible in the sense that we should not give something in the rewards of food, or like in this case the reward situation like the mobile and all. So since he is 7 years old, first thing is you ask him to make a schedule, and in which you make him sit down and also ask him to do that. So come on, when will you when should we get up in the morning? So around 9, is it fine with you? So involve him also in making a schedule, make him follow that schedule, and you don't need to reinforce like every time. So when we ask you should give when you are giving a command to the child, if he's not doing, so there are various ways. So first thing is you tell him by prompt, like you do it, then only I will means you have to complete this task. So because it is in your schedule. Okay, and never if he is saying like that, only then I will eat. You just tell him. So TV or screen time is only 1 hour in the evening. That is it. Apart from that, means nothing else that will be there. So because he is already into a habit now, so don't, he's kind of bargaining and manipulating now. So don't let him, allow him to do that much. So involve him in making a schedule that screen time in last 1 hour in the evening, anytime, like give him a choice of that. It can be 5 to 6 and 6 to 7. Once the child himself have made a choice, then you can tell him like this is your choice only. So we'll have to follow that. And definitely if even one day he's following this, so you kind of make a, what we call it as a star charting. So if he has done 5 days he has followed the schedule, so then in the 6th day you can give him some extra screen time, or maybe if it is an addiction, then maybe extra play time outside, half an hour. So because we have to try cutting off the screen, so try to do it in some other way. So let's see how the things goes. Okay.
Yes, ma'am. And then actually elder kid, he is behaving like small, ma'am. Actually younger one 7 years old, he is in 8th. Elder one, he is in 11th year, but he used to play on the floor or sit. He is pushing like that only, ma'am. He don't want to play with any other toys. He wants to play with small cars. By pushing and pulling back, he is observing that wheels. He is behaving like 7 years or 5 years kid. Always he used to sleep or lie down on the floor, and then he is playing with the cars only, ma'am.
This is for the elder one you are saying.
Elder one, ma'am. And then he wants to move more like that means most of the time with small more than his age people. That means
very big elder children, more elder than him, or much younger, not of his.
Okay. And this was there since beginning only. The recent issues has not been. It is not that it has started after the recent trauma incident.
No, this was there from beginning.
Okay.
So but from 2 years old, we are observing that he plays with a toy, just toy cars, moving back and forth in the windows or lying down on the floor, and just he observes car movement, and he likes cars. Cars a lot, ma'am.
We don't know whether we can say stop, don't do like that. We have to say that or no, we don't know, ma'am. We have to say, Nana, don't play like that, be mature. We want to say, but always, but maybe it is good or not. We don't know, ma'am. Shall we say don't behave like that, ma'am?
Okay, fine. And I think then in that case, I think better, like if it is possible for you to see me personally or someone else, or if you can just talk to someone in the school also, it will be better, so that we have a better idea. If needed, like is it only in one situation that it is happening, or it is throughout? We will have to see whether it is affecting his daily skills and all. Okay.
How can we approach one? We have to contact school, or
you can you can do that as well, or you can contact Ankura directly.
Which branch, ma'am? Actually, Ankura Kondapur or?
I am available at Madinaguda one. Yeah, Madinaguda KPHP. Yeah. If
Okay.
anyone, yeah.
Sure.
Thank you.
Thank you. Thank you so much.
Yeah,
ma'am.
thank you, ma'am. Thank you.
Thank you.
Anyone else, dear parents? Okay, ma'am, then we should end the session, I think. Thank you very much, ma'am, for addressing this burning topic and clarifying our doubts. On behalf of Kairos International School, I would like to thank you for joining us today and enlightening us. Thank you.
Thank you.
Thank you,
very
dear
much
parents,
for
for
giving this.
joining.
Thank you. Thank you everyone for joining.
Bye-bye. Have a good day.
Thank you, ma'am.
Thank you.
Thank you, ma'am. Bye.